Infections are a common health concern that can affect anyone, regardless of age, gender, or lifestyle. They are a significant cause of illness and can lead to various health complications if not properly managed. Infections occur when harmful microorganisms, such as bacteria, viruses, fungi, or parasites, invade our bodies and begin to multiply. These invaders can enter through various means, including cuts, inhalation, ingestion, or even through insect bites. These invaders, known as pathogens, come in many forms. Bacteria are single-celled organisms that can cause diseases like strep throat or urinary tract infections. Viruses, which are even smaller, can lead to illnesses such as the flu or COVID-19. Fungi, like yeast and molds, can cause infections such as athlete's foot or ringworm. Parasites, including protozoa and worms, can lead to diseases like malaria or tapeworm infections. Our bodies have natural defenses, such as the skin, mucous membranes, and immune system, to fight off these pathogens. However, sometimes these defenses are overwhelmed, especially if the immune system is weakened or if the pathogen is particularly virulent. When this happens, an infection can take hold and spread. Body infections can vary greatly in severity. Some infections are mild and may resolve on their own without medical intervention, while others can be severe and require prompt medical treatment. In extreme cases, infections can be life-threatening, leading to conditions such as sepsis or organ failure. Understanding the causes, symptoms, and treatments of body infections is crucial for maintaining good health. Recognizing the early signs of an infection can lead to timely medical intervention, which can prevent complications and promote faster recovery. By learning about infections, we can take proactive steps to protect ourselves. This includes practicing good hygiene, such as regular hand washing, staying up to date with vaccinations, and avoiding close contact with individuals who are sick. Additionally, seeking appropriate medical care when symptoms arise is essential for effective treatment. This essay will delve into the world of body infections, exploring their causes, symptoms, diagnosis, and treatment options. We will examine how infections are diagnosed through various tests and imaging techniques, and discuss the different treatment modalities, including antibiotics, antivirals, antifungals, and antiparasitics. We will also discuss home remedies for minor infections, such as using honey for sore throats or applying aloe vera to minor burns. Additionally, we will cover preventive measures to reduce the risk of infection, such as maintaining a healthy diet, getting regular exercise, and ensuring proper wound care. Join me as we uncover the secrets of these microscopic invaders and learn how to defend our bodies against their attacks. By understanding the nature of infections and how to combat them, we can better protect our health and well-being, ensuring a healthier future for ourselves and our loved ones.
To understand body infections, we must first identify the culprits responsible for these invasions. These culprits are often invisible to the naked eye, yet they have a profound impact on our health and well-being. As mentioned earlier, the primary perpetrators are microscopic organisms known as pathogens. These pathogens are diverse and can be found in various environments, from the air we breathe to the water we drink. These tiny invaders can be categorized into 4 main groups: bacteria, viruses, fungi, and parasites. Each group has unique characteristics and ways of causing infections, making it essential to understand their differences. Bacteria are single-celled organisms that are present everywhere in our environment. They can be found in soil, water, and even in the human body. In fact, our bodies host trillions of bacteria, many of which are beneficial and play crucial roles in processes like digestion and immunity. While many bacteria are beneficial, some can cause harm by releasing toxins or invading tissues. These harmful bacteria can lead to a variety of infections, ranging from mild to severe. Examples of bacterial infections include strep throat, urinary tract infections, and food poisoning. These conditions can cause significant discomfort, and in some cases, may require medical intervention to resolve. Viruses are much smaller than bacteria and require a host cell to replicate. Unlike bacteria, viruses cannot survive or reproduce on their own. They need to invade healthy cells and hijack their machinery to produce more viruses. They invade healthy cells, hijacking their machinery to produce more viruses. This process often damages or destroys the infected cells, leading to symptoms of illness. Common viral infections include the flu, the common cold, and chickenpox. These infections can spread rapidly through populations, especially in crowded or unsanitary conditions. Fungi are a diverse group of organisms that include yeasts, molds, and mushrooms. They thrive in various environments, from damp basements to forest floors. While most fungi are not harmful to humans, some can cause infections, particularly in people with weakened immune systems. These infections can range from superficial skin conditions to more serious systemic infections. Athlete's foot, ringworm, and yeast infections are examples of fungal infections. These conditions can cause itching, redness, and discomfort, and may require antifungal treatments to resolve. Parasites are organisms that live in or on a host organism, benefiting at the host's expense. They can cause a wide range of health problems, from mild irritation to severe disease. Parasitic infections can be caused by protozoa, helminths, and ectoparasites like lice and ticks. These parasites can be transmitted through contaminated food, water, or insect bites. Malaria, tapeworm infections, and Lyme disease are examples of parasitic infections. These conditions can have serious health consequences and often require specialized treatments to manage. Understanding the different types of pathogens and their modes of transmission is crucial for preventing and treating infections effectively. By educating ourselves about these microscopic invaders, we can take steps to protect our health and reduce the spread of infectious diseases. This knowledge empowers us to make informed decisions about hygiene, vaccination, and other preventive measures, ultimately contributing to a healthier society.
Bodies have remarkable ways of signaling when something is amiss. These signals are often subtle at first, but they can become more pronounced as the body continues to fight off the infection. It's important to pay attention to these early warning signs, as they can help us take action before the infection becomes more serious. Infections often manifest with a range of symptoms, each indicating a different aspect of the body's response to the invading pathogens. These symptoms can vary widely depending on the type of infection and the part of the body that is affected. For instance, respiratory infections might present with coughing and congestion, while gastrointestinal infections could cause stomach pain and diarrhea, alerting us to the presence of unwelcome invaders. The body's immune system is constantly on the lookout for these invaders, and when it detects them, it springs into action. This response is what causes many of the symptoms we associate with infections. The immune system's goal is to eliminate the pathogens and restore the body to its normal state. Recognizing these symptoms is crucial for seeking timely medical attention and preventing complications. Early detection can make a significant difference in the outcome of an infection. By identifying the symptoms early, we can seek medical advice and begin treatment sooner, which can help prevent the infection from spreading or becoming more severe. One of the most common signs of infection is fever. Fever is the body's way of creating an environment that is less favorable for the pathogens. It is a natural defense mechanism that helps to slow down the growth of bacteria and viruses. However, it's important to monitor a fever closely, as a very high fever can be dangerous and may require medical intervention. When pathogens invade our bodies, our immune system releases chemicals that cause an increase in body temperature. These chemicals, known as pyrogens, are produced by the immune cells in response to the infection. They travel to the brain and signal the hypothalamus to raise the body's temperature. This increase in temperature helps to enhance the immune response and make it more effective at fighting off the infection. Fever helps create an inhospitable environment for some pathogens and enhances the body's immune response. By raising the body temperature, the immune system can work more efficiently to eliminate the invaders. Additionally, the higher temperature can inhibit the growth of certain bacteria and viruses, making it harder for them to survive and multiply. Pain is another frequent symptom of infection. Pain can be a result of the body's inflammatory response to the infection. When tissues are damaged or infected, the body releases chemicals that cause inflammation and pain. This pain serves as a warning signal, alerting us to the presence of an infection and prompting us to take action. It can be localized to the site of infection, such as pain at a wound site, where the body is actively fighting off the invading pathogens. This localized pain is often accompanied by redness, swelling, and warmth, which are all signs of inflammation. The pain can be sharp or throbbing, depending on the severity of the infection, or it can be more generalized, like muscle aches or headaches. Generalized pain is often a sign that the infection is affecting multiple parts of the body. For example, a viral infection like the flu can cause widespread muscle aches and headaches as the body mounts a systemic immune response to fight off the virus. Inflammation, a natural response to tissue injury or infection, often contributes to pain. Inflammation is the body's way of protecting itself from further damage. It involves the release of chemicals that increase blood flow to the affected area, bringing immune cells to fight off the infection. While inflammation is a necessary part of the healing process, it can also cause discomfort and pain. Swelling is often observed at the site of infection. Swelling occurs when fluids and immune cells accumulate in the affected area. This is part of the body's effort to isolate the infection and prevent it from spreading. The increased blood flow and accumulation of fluids can cause the area to become swollen and tender. When tissues become infected, blood flow increases to the area, bringing immune cells to fight off the invaders. These immune cells, such as white blood cells, are essential for identifying and destroying the pathogens. The increased blood flow also helps to deliver nutrients and oxygen to the affected tissues, supporting the healing process. This influx of fluids and cells can cause the affected area to swell. The swelling is a visible sign that the body is actively fighting the infection. While it can be uncomfortable, it is an important part of the immune response. In some cases, the swelling may be accompanied by pus formation. which is a sign that the body is clearing out dead cells and pathogens. Fatigue is a common symptom of infection, often accompanied by weakness and a general feeling of malaise. Fatigue occurs because the body is using a lot of energy to fight off the infection. This can leave us feeling tired and drained, even if we are getting enough rest. It's important to listen to our bodies and allow ourselves to rest and recover. Our bodies divert energy towards fighting off the infection, leaving us feeling drained and lethargic. This energy diversion is necessary for the immune system to function effectively. However, it can also make it difficult to carry out our daily activities. It's important to take it easy and give our bodies the time they need to heal. Other symptoms of infection can include redness, which is often a sign of inflammation. Redness occurs when blood vessels in the affected area dilate, allowing more blood to flow to the site of the infection. This increased blood flow helps to deliver immune cells and nutrients to the area, supporting the healing process. Warmth, which is another sign of increased blood flow. The affected area may feel warm to the touch, as the body directs more blood to the site of the infection. This warmth is a sign that the immune system is actively working to fight off the pathogens. Pus formation, which is a sign that the body is clearing out dead cells and pathogens. Pus is a thick fluid that contains dead white blood cells, bacteria, and tissue debris. It is often seen in infected wounds and can be a sign that the body is successfully fighting off the infection. Skin rashes, which can occur as a result of the body's immune response to the infection. Rashes can vary in appearance and may be itchy or painful. They are often a sign that the body is reacting to the presence of pathogens or toxins. It's important to note that symptoms can vary depending on the type and location of the infection. Some infections may cause only mild symptoms, while others can be more severe. If you experience any unusual or concerning symptoms, it's essential to consult a healthcare professional for proper diagnosis and treatment. Early intervention can help prevent complications and ensure a faster recovery.